क्योंकि आपको भी पता होना चाहिए व्हाट आर द रेड फ्लैग साइंस. कभी कभी पीडियाट्रिशियन नहीं आ पाता, देर हो जाती है. यू शुड बी अवेयर. Early recognition save life. According to WHO, approximately 2.5 million newborns die annually, with a significant proportion attributed to preventable causes such as perinatal asphyxia and sepsis. India contributes to nearly 1/5 of the global neonatal deaths. Early detection and intervention for red flag sign have shown up to 40% reduction in neonatal mortality. The red line is obstetricians play a key role in identifying red early flag signs. Note down. What are red flags? Warning signs. Red flags are warning signs requiring urgent assessment, stabilization or referral. Delay is death. Common red flags are respiratory difficulty, poor feeding, hypothermia, sepsis. Often they overlaps, must be recognized early. Poor feeding is the most important part. Weak sucking or refusal to feed, sleepy or floppy baby. Common in sepsis, asphyxia, hypoglycemia or cardiac issues. Always check the temperature, blood glucose, infection markers. Immediate steps are keep warm, check sugar, start IV fluids 10% dextrose. Timely referral if required. Clinical relevance. Feeding difficulty is often the first sign of the underlying problem. A neonate who fails to suck effectively may have systemic illness, metabolic derangements, neurological dysfunctions, hypothermia or sepsis. Persistent poor feedings require urgent evaluation. Always do the blood glucose estimation. Investigation may include sepsis screening, echocardiography or neuroimaging as indicated. The management is treatment involves addressing the underlying cause. For hypoglycemia, early feeding or IV 10% dextrose. For infection, initiate empirical antibiotics. Start breastfeeding. Supportive monitoring, intake output chart are the key aspects. The other part is respiratory problems, respiratory distress. Now, newborn it is both ways, no respiration or fast respiration. Newborn may present with a poor or absent respiration. Cyanosis, Apgar is the most important sign. Score of 7 at 5 minutes indicates risk. Associated features include poor cries, seizures, altered consciousness. Immediate management include NRP protocol, which will be told to you by Dr. Azad after me. The priorities include airway clearance, positive pair ventilation and chest compression. The other part is tachypnea. If the respiratory rate is above 60, is abnormal in newborn. It is with chest retractions, grunting, nasal flaring, cyanosis. The important causes are transient tachypnea of newborn. It is a benign condition, or HMD, pneumonia, sepsis or congenital heart disease. The actions are give oxygen, thermoregulation, early referral into NICU. Now the temperature in the newborn is important. Below 36.5 is hypo and above 37.5 is fever. Hypothermia leads to apnea, hypoglycemia or death. Fever often indicates infection. There are a number of other causes also. Maintain warm chain, monitor glucose, start antibiotics if indicated. Hypothermia, continue temperature monitoring is essential in NICU setting. Do it every 13 minutes. Hypothermia causes are environmental exposure, inadequate drying. Dry the baby immediately after delivery. At birth, unheated delivery room. Maintain the proper temperature in your room. And prolonged transport without warm protection are the key causes. Preterm and low-born baby infants are the most vulnerable. Maintain warm chain, warm delivery room, immediate drying, skin-to-skin care, warm transport. Skin-to-skin care may put the baby immediately on the abdomen of the mother after normal delivery, after LSCS. And appropriate clothing. For moderate to severe causes, use radiant warmer incubator. Maintain temperature every 30 minutes. Jaundice. Red flag is if the onset is within 24 hours. Rapid rise, pale stools, dark urine, lethargy. The causes can be hemolytic disease, sepsis, biliary atresia. Always do serum bilirubin, early phototherapy, prompt referral. The physiological jaundice we all know is peaks at 3 to 5 days and usually resolves by 10th day. The seizures, they may be subtle like leg smacking, blinking, they are normal, but apnea spells, they are alarming. The causes are hypoxic injury, hypoglycemia, hypocalcemia, infection. Always check blood glucose, calcium, manage airways, initiate antibiotic convulsions if needed. Vomiting and abdominal distension. Sometimes this happens in newborns also. Bilious vomiting indicates intestinal obstruction. Non-bilious vomiting is feeding intolerance or sepsis. Progressive distension, absent bowel stools are dangerous. Always stop feeding, start IV fluids, refer to surgical neonatal center. Sepsis indicators. Poor feeding, lethargy, temperature instability, respiratory distress are the sepsis indicators. Umbilicus, redness, pus or discharge is alarming. Do not delay antibiotic for cultures. Start empirical therapy and support care immediately. Some fake signs are there, we have to be aware of those. Hiccup or mild sneezing, brief stuttle movements, temporary mottling of the skin, mild regurgitation post-feeding, they are all normal. Always correlate clinically before labeling as a red sign. The summary is, early recognition saves lives. Red flags, poor feeding, lethargy, temperature changes, seizures, jaundice, vomiting, cyanosis. Fake danger signs may mislead, rely on overall clinical status. The golden rule is, when in doubt, treat as a sick newborn and take expert advice and timely referral. Doctor restore not just bodies but hope, smiles and dreams. Thank you.